As a doctor, when someone comes in and asks you about a strain, what type of things are you looking for to help diagnose that? And also, yeah, let's leave it at that. Let's diagnose it.
Okay. All right. So a muscle strain, if you come in and you have had a recent injury and it feels more muscular, like in the muscle belly, we'll just use the leg for the time being. First and foremost, we're going to look at it. We want to see if there's some swelling that you can visually see, some bruising that's going to tell us a lot as well. But then also muscular strength of that said area or tissue itself. And we utilize some form of a muscle strength test, an isometric contraction, even just palpation of the tissue if it's going to, what's the term? Kind of kick back at you. It's going to feel like there's some actual muscular contraction. It's still a good thing. That's kind of first and foremost.
When someone does have a strain, what can they expect as far as recovery and time frame?
Sure. Okay. Again, depending on how bad of a muscle strain it is, if it's considered like a grade 1 muscle strain, you're probably going to be feeling good in a couple days. It will probably go away on its own if you're safe about it and you don't re-injure yourself. There's a difference between what we call structural healing and functional healing. Functional healing is more where I can get back to my normal everyday work, I can lift, I can be active, and it's not really causing any new injury or issue. Where structural healing, that's kind of happening in the background, right? And it takes a little bit longer. If we're talking like grade 1, you might be good in 2 to 4 or 5 days on the functional healing aspect after a muscle strain. But a structural healing, that might take more like a couple of weeks before that tissue's had enough time to get both blood flow, nutrients, and some time, and also some load that's good for it to feel like it's back to normal and is stronger. Just from doing some of our own research, the term delayed onset muscle soreness, also known as DOMS, that is kind of considered like a grade 1 tear. It's below 10% of an injury in a muscle, but it's like repeatable every time that you work out, especially if you're pushing pretty hard. You get that day after soreness, 2 days after soreness, and it feels kind of just like achy and not comfortable. That's kind of considered like small muscle strain. Grade 2 could be anything from, again, above about 10% tear up to almost 99%, because that's anywhere in that range of there's still a connection of the muscle to the rest of the portion of it. But those signs and symptoms are very different. There could be a lot more bruising, a lot more pain, a lot more muscle weakness. But again, structural healing can happen depending on how much of an unfortunate tear there is, but it's going to take longer time, more than like that 2 to 3 or 4 months. And again, it's dependent on the person. There is not a window that says it's going to be 12 weeks every time. It is also off of what you're doing day to day. Are you restraining it? Are you feeding it good nutrients, good proteins, that type of stuff? So part of the rehab or the protocols after a muscle strain, paying attention to your multivitamins, your minerals, that type of stuff. We're going to go into that, put it into a list, as well as paying attention to maybe a little bit more protein intake post-injury. Both of those things are really important. And then good load, being cautious with it if it's a really bad tear. And then if it's a grade 3, it's a lot of pain at the onset of a grade 3 tear, and then it kind of goes away because there's not a neurological connection to that muscle, but it doesn't have that same muscular control anymore. And again, that's more, let's go pay attention to getting in to look at possible surgery.
That is phenomenal information on strains from Dr. Bird. We hope this helps, and if you do have a strain, feel free to reach out and get an appointment with him.
There we go.